So in this video, I'm going to discuss the management of asthma and the common medications which asthmatics may be taking and how this will impact on you. So remember the pathophysiology of asthma, that it's a chronic respiratory condition, and that condition involves inflammation of the airways, bronchoconstriction, and increased mucus production. So the primary goal of asthma treatment and managing asthma is to control the features I've just discussed and try and manage the patient's symptoms effectively. So there is a stepwise approach which is taken, and this is how their general medical practitioner will tailor their treatment. And this is dictated by the British Thoracic Society. And the guidelines really are aimed at the GPs on how to manage patients with asthma. And in addition to that, there's obviously the acute management. So if you have an understanding and awareness of this stepwise approach, then you should be able to recognise the level of control and the level and complexity of disease that your patient has with regards to their asthma by looking at the medications they're taking. In addition to this, patients should be advised to avoid any precipitants, and smoking cessation advice should also be given for asthma. So the stepwise approach starts with step 1, and this is using a short-acting beta-2 agonist. And this should be used for symptomatic treatment. So in the first stages, they'll be given this to use as and when. And if the patient is using this more than once a day or has symptoms of their asthma at night, then generally they're then moved on to step 2. And step 2 would be adding in a short-acting beta-2 agonist and a standard dose inhaled steroid, e.g. beclometazone. If that doesn't manage their symptoms, then there's step 3, and this is adding in a long-acting beta-2 agonist such as salmeterol. Now, if there's inadequate control, then a leukotriene receptor antagonist or oral theophylline can be commenced. So having an awareness of these medications will give you an idea of that complexity of asthma. Now, step 4 is a trial of a higher dose beclometazone or modified release oral theophylline or modified release oral beta-2 agonist. Now, it might be on top of all that they need adding in an oral steroid like prednisolone at the lowest dose that will control the symptoms. And at this point is then when they need to be seen by a specialist and further management ensued. So the medications I've talked about come in different classes, and it's important you have an awareness of those and how they work. And they work through different mechanisms. And the mechanisms that they use are obviously used to achieve management and control of their asthma. So some of the key ones that I've talked about already are inhaled corticosteroids. So an example of this might be fluticasone, budesonide, beclometazone. And they're the common ones that you might come across. So how do these work? What's their mechanism of action? So they're used to reduce the inflammation in the airways, decrease the mucus production, and the risk of bronchoconstriction. So the symptoms that we talked about at the start. And these drugs are considered a mainstay for long-term asthma control. So they're going to be the common group that you see. Now the next ones that I've talked about are the long-acting beta-2 agonists, or LABAs, L-A-B-A-S. And examples of these might be salmeterol, formoterol. And these act by relaxing the smooth muscles in the airways that cause the bronchoconstriction, so therefore will lead to bronchodilation. And they're often used in combination with the first group that I talked about for better asthma control. The third group are short-acting beta-2 agonists, or SABAs, and this is albuterol, levalbuterol. And these provide a rapid relief of acute bronchoconstriction, and they do this by quickly relaxing the smooth muscles in the airways, so that bronchoconstriction will then be relaxed and dilate. And these are commonly used as rescue inhalers during an asthma attack, so patients may have these as their kind of breakthrough medication. The fourth group are the leukotriene modifiers, so you might hear montelukast is an example of that. And the way that these work are inflammatory mediators that play a role in asthma. So the leukotriene modifiers, they reduce the effect of the leukotrienes and therefore helping control the inflammation and bronchoconstriction that cause the symptoms of asthma. And the fifth group are mast cell stabilizers. So you might come across cromolyn or nidocromil. And this group, the mechanism of action is to prevent the release of the inflammatory substances from mast cells, therefore helping reduce inflammation and prevent bronchoconstriction. Now, this group of drugs are often used as what patients might call preventative medications. And the sixth group are anticholinergics. So this might be something like ipratropium or tiotropium. Now the anticholinergics block the action of acetylcholine. And acetylcholine, you should be familiar with, is a neurotransmitter that causes bronchoconstriction. So these are typically used to dilate the bronchiole, so bronchodilators. And the final group are biologics, which you may be familiar with. These aren't commonly used for asthma, and you might not see many patients on these. But the mechanism of the action of the biologics is to target specific pathways involved in the immune response, to therefore reduce inflammation in severe asthma cases. And these are often reserved for individuals with difficult to control asthma. So usually those patients who have gone into secondary care and are managed by a specialist. Now it's important to note that the choice of medication used for the treatment of the condition and its combination depends on the severity and the type of asthma, as well as the individual patient characteristics. Now many individuals with asthma use a combination of medications, and this combination often includes both a controller, so something to maintain stability, and then a rescue medication to effectively manage their condition. And the goal of the management really is to achieve and maintain good asthma control, therefore allowing individuals to lead active and symptom-free lives. Now it's important that you have regular communication between your patients' healthcare providers to enable that we provide a coordinated care and consider any potential interactions with the treatment that you might be providing or the medications that they may be taking. And then just to finish on the management of an acute severe asthma attack, certainly in general dental practice you're fairly limited. It's important to have an air of calmness, sit the patient up, give them high dose oxygen, so 15 litres per minute through a non-rebreathe face mask, and allow them to take their reliever, so that's probably going to be salbutamol as an inhaler, or if they're unable to synchronise the inhaler, then you can use a spacer device. I think if you get into that point and you're administering oxygen, then get help, 999, and get an ambulance. You want to monitor their vital signs, and you will be limited as to what vital signs you can monitor in general dental practice, but it's really important that you do that. And any deterioration, phone 999 again.